favorite topics, and that's hormone replacement therapy, and especially hormone replacement therapy with autoimmune diseases, because it is super nuanced and I see a lot of bullshit out there. So let's kind of break some of these things down. So number one, why would you use hormone replacement therapy? Well, because through the perimenopause and menopausal transition, your hormones go out of whack and you can just start not feeling like yourself at all. There's also robust evidence that using HRT helps prevent certain diseases, especially cardiovascular disease, cognitive diseases like dementia, and it protects your bone. So it protects your heart, protects your bones, and it can protect your brain function. All three things I think we can all agree are good. Now, when it comes to HRT and autoimmunity, I see a lot of misinformation out there. So let's break down some of them. Number one, HRT can trigger autoimmune disease. This just isn't true. Hormones do not directly trigger autoimmune diseases. Hormones can influence disease states. It can make things better or it can make things worse, especially things like lupus, which tends to be sensitive to estrogen levels. If you're taking HRT and the hormones aren't balanced, it can cause a trigger. It can cause a flare in symptoms. So you need to be really cognizant about that disease process and where you're at in terms of your symptoms and your disease state and how hormones may or may not influence your particular autoimmune disease. People with autoimmunity just should not take HRT. Again, this is not necessarily true. A lot of times, putting someone on hormone replacement therapy can be really beneficial for their autoimmune disease, especially when their hormones are just starting to go super duper wild through the perimenopause, menopausal transition. Okay, so there are certain autoimmune diseases that you need to use a bit more caution with. So things like antiphospholipid syndrome, where you have an increased risk of blood clotting. If you take estrogen, that can increase your risk of blood clotting. So if you already have a condition where you can clot easily, using hormones is sometimes contraindicated or can be dangerous. So we need to be very aware of that. We also have to think about how we're delivering the hormones and how we can reduce risk of blood clotting. So putting estrogen in your mouth tends to increase the risk of blood clots versus putting it directly on your skin. So using a patch or a cream can decrease that risk of blood clotting. And then on the opposite side of that, I sometimes see people say that HRT can cure autoimmune diseases. This goes back into how hormones influence the immune system and how it can either make things worse or make things better. So sometimes, yes, using HRT can help induce remission, improve your autoimmune disease state, but is it a cure-all? You're going to start HRT and cure everything? Probably not.